Well, the short answer to the question who should receive the influenza vaccine is everybody, age 6 months and over. Under 6 months, we don't have an influenza vaccine that is licensed, but from 6 months and over, everybody should receive the vaccine. Now, that is not possible because you have to finance the vaccine. And where patients actually buy the vaccine, then those who can afford to do it, do so. There are other countries where they make it available to people who are in the groups at risk. Now, in the UK, if I was to take this as an example, the government makes the influenza vaccine available to us general practitioners to give to patients who are really at risk. So everybody over the age of 65 is considered to be at risk, blanket, no matter what whether you're healthy or not. Under the age of 65 and over 6 months, then special groups of patients actually should receive the vaccine. On the top of the agenda are really patients with heart disease, with respiratory disease, chronic obstructive pulmonary disease, asthma, bronchiectasis, emphysema, all these and other respiratory diseases. We really need to vaccinate these patients. Patients with liver disease, with kidney disease, who have had strokes in the past or any neurological condition, like, for example, multiple sclerosis and so on. Patients who have diabetes, very important they have the vaccine. Also, patients who are considered to be immunosuppressed. That can be because of disease or of treatment that they are having that renders them immunosuppressed. A very important group of patients that must have the vaccine are pregnant women. And that's really extremely important that they are vaccinated. We also need to look a little bit wider. Anybody who is living in a long-term establishment like nursing homes, residential homes, and so being in hospital, we need to really vaccinate everybody as well. If we don't vaccinate the healthcare workers and also the social services people who work there, then if they go down, then we don't have their services. And they are crucial. If the ambulance crew is down with influenza at home, then you don't have the ambulance vehicle to come and pick you up. If your doctor or your nurse is down with influenza, they are not there to actually see their patients. So it is very important that health and social care workers are vaccinated. And in the UK, we are really trying to increase the rate of immunization. We didn't do very well last year, and we are hoping to do so much better this year.